Hello everyone, sorry for the technical problems. We're back online now. My name's Dr. Shweta Kaushik and I'm a glaucoma specialist. I'm coming to you live from Sydney. This Facebook live session is on OCT testing and it's part of the Glaucoma Australia celebration of World Glaucoma Week. So I'm glad that you could all join us. I'm going to be talking a little bit about OCT testing first, and then at the end of the session, I'll try to answer some of your questions. All right, so OCT testing. OCT is otherwise called optical coherence tomography, and you can see why we use the short form of OCT testing. Much easier to say, much easier to remember. So what is OCT testing? Why is it important in glaucoma? OCT testing is really part of a bigger picture of tests that we do on glaucoma patients. It really can't be used in isolation. It's used in conjunction with visual field testing, with taking a history from our patients, and looking at the back of their eyes, doing an examination of them. So it's really an ancillary test. It's a supportive test along with a whole host of other tests. OCT is used in lots of different parts of ophthalmology, to look at diabetic retinopathy, to look at macular degeneration, but it's also used for glaucoma. Glaucoma is a disease of the optic nerve. It's a condition where the nerve fibers within the optic nerve are destroyed over time. So the optic nerve is a cable of fibers that goes from the eye to the brain. And it basically is filled with nerve fibers. We have about 1 million of them when we're babies, and then we slowly lose some as we age, but in glaucoma we lose them much more frequently. So this big cable of information is getting sent from eye to brain. So what happens is that light goes through the cornea, which is the front window of the eye, through the pupil and to the back onto the retina. So the retina is like the inner lining of the eye and acts like a film. It captures the image and it basically sends the image up the nerve to the brain. In glaucoma, if you have fewer of those nerve fibers, your vision goes down. And it goes down over months. Rather than months and weeks, it goes down over years and decades. So it's a slow process. And the pattern of vision loss is that our peripheral or edge vision goes first. So we don't really know that we've got it sometimes until it's too late. And so that's why things like visual field testing and OCT testing is so important. So let's look at how the actual OCT works. An infrared light is sent through the pupil to the back of the eye. And this infrared light is sort of a short wavelength light. It's very safe for the eye. It doesn't damage the eye tissues. And in fact, there have been millions of OCT scans performed all around the world without any evidence of damage to the eye. So basically, this infrared light that gets sent in, lots of reflections of it come back and are captured by the OCT image scanner, and that gives us a beautiful pattern of the back of the eye. And it's quite high resolution, not down to the cells, but to the actual layers of the retina. And if you can imagine that the retina is about 300 microns or 0.3 millimeters, it's really quite high resolution that you can get with an OCT. So basically, this OCT test gives us a picture of the back of the eye. I'm going to show you some examples. So if you'll just permit me some changes to my screen while I'm sharing it. I want to show you, it's much better to see it. You'll know what I'm talking about. So I'm just going to push myself to the side there. All right, so these are two OCT scans. The one on the left is in a person who doesn't have glaucoma. And the one on the right is with a person who has glaucoma. So basically, if you look at this coloured thickness map here, this map basically shows us the thickness of tissues around the nerve. So can everyone see that grey dot in the centre? That's actually the head of the optic nerve. The colours, the blue, red and yellow, gives us an idea about the thickness of tissues. So I told you a little bit about those retinal nerve fibres that travel in the nerve. So basically what happens is these nerve fibres are in the retina and they basically congregate at the top and the bottom of the nerve. So you can see that here and here. And they're about to turn and travel in the nerve back to the brain. So this sort of red and yellow tissue is thicker tissue. So blue is the thinnest, then yellow, then red, then white. So this red and yellow tissue is basically the point of maximum concentration of those nerve fibres. And bingo, it pretty much includes all of the nerve fibres of the eye in that little square. So it can really tell us about the thickness of the nerve fibres and where they're located. So if you have a look here, the red and yellow is pretty similar in both eyes, and this patient probably has quite a normal thickness of nerve fibres. Let's go over to this scan here in the person with glaucoma. So you can see that the grey dot in the centre, or the grey circle in the centre, is a little bit larger. So this particular individual's optic nerve head size is a little bit larger than the other person. And that can happen. You get lots of individual variation. But you can see that this individual has very little amounts of red and yellow at the top and the bottom of both eyes. So this individual, in fact, has lost quite a lot of nerve fibres and actually has very advanced glaucoma. So just a simple eyeballing of the left to the right scan can show you the difference. The rest of the scan is used by your eye healthcare professional to basically quantify the amount of loss, and then it's compared to a normal database of patients your own age or the individual's own age. Okay, there's only one more picture I want to show you, and so bring myself back up again. This is an OCT scan image of an individual who's had many OCT tests. So this individual first started having tests in 2009, 2010, and the latest tests that I have are 2015. So basically, what's happening is that these later tests are being compared to the individual's baseline tests, and that's really where OCT is powerful. These tests would have been compared to the normal database of people your own sort of age. However, what's great about this is this individual has enough tests so that the later tests can tell us if there's been any change, many years earlier when the baseline tests were conducted. So let's have a look at this particular individual. You can see that the red and yellow colours in 2009 and 2010 are much less in 2015. So there's been some thinning that's happening. And in these sort of black and white and grayscale tests, you can see that the locations of where the nerve fibre layer has been lost in that bright red colour. And if you come down to these graphs, you can see that you have age along the bottom and you have thickness along the vertical axis. And you can see that this person first had tests at 73 and their last tests were around about 79 years. And what's basically happened is that over time, the nerve fiber layer thickness has reduced as the patient has gotten older, both superiorly, so at the top, and inferiorly at the bottom, and overall average. This person has had tests about once a year, roughly, and you can see that what's really powerful about this is that there is very little variability from one test to the other. So that if you see a change on the OCT, it's not because of measurement error, or it's unlikely to be due to measurement error. It's likely to be the real deal. It is very consistent from one test to the other. Okay, so we've covered that. So let's go back to the video. So let's talk about why OCT is important to know over time. If we know that our nerve fiber layer is thinning over time, how can that help us, and how can that help our doctors? Well, in fact, to see a lot of thinning of the nerve fiber layer, you need to see about 50% of it loss before you see change on your visual field test. So before you see vision loss, you've already lost, your nerve has already become really thin. So in fact, OCT can tell us that your glaucoma is progressing oftentimes before you see changes in your vision on the visual field test. So some studies tell us that in about 40% of patients, the OCT can tell us 4 years ahead of time that your glaucoma is worsening. And in about 20% of people, it can tell us 8 years ahead of time. Now that's a substantial lead time for your doctors to know that your glaucoma is getting worse and to do things to help stabilize that progression. Okay, so let's just cover a few other points. Let's talk about how many OCTs, why do we need to do so many OCTs? And we go to our doctors all of the time, and they do one almost every time we go there, or once a year. Why do we keep repeating it? Isn't it just telling us the same thing? Well, as I've mentioned before, no, actually, it's really a powerful indicator of change. How many do we actually need? Well, we don't have as much information in the literature about OCT testing like we do with visual fields. Some people think that we need something like a visual field every 6 months to really get a handle on progression. So some experts say that OCT testing should be the same frequency. We need OCT testing every 6 months for the first 2 to 3 years that we see a patient to get a real handle on if they're getting worse or not. Generally, most people do an OCT once a year, and that's okay as well. But the theory is if you do more tests, you get a quicker understanding of how quickly the person in front of you is progressing. And that's why doing frequent OCT testing is so important. It can seem like a real drag, but it's super important. Okay, so some people want to know whether you still need to do a dilated eye examination if you've had an OCT of your optic nerve. The answer is yes. So as I mentioned before, you have to do a whole, you need to know a lot about the patient to make a diagnosis of glaucoma and to understand if their glaucoma is progressing. And OCT is just part of it. You need to do visual fields. You need to have a look at the optic nerve. You need to have a look at the patient's front of the eye to see if there are different causes of their glaucoma. So looking at the optic nerve is really important, and sometimes you have to dilate the patient to be able to see the nerve properly. What can the nerve tell you? Well, sometimes the nerve can have a hemorrhage on it, and that can't be seen on an OCT. And that hemorrhage is an indication that the nerve is under stress and that the glaucoma might be progressing, and that the doctor needs to move early to change your treatment plan in order to reduce the rate of progression of your glaucoma. Sometimes you need to do a dilated eye exam because the patient might have other conditions other than glaucoma. They might have diabetes or macular degeneration. And so though you might not need a dilated exam every single visit, one at baseline when you see the doctor first, and then once every 1 to 2 years is a reasonable amount, depending on the individual and their other conditions. So in the same vein, if you do an OCT and you look at the nerve, do you still need a visual field test? Well, yes, you do. And this is where I want to make another important point. Sometimes patients can start off with really thick nerves, with really thick nerve fiber layer. But actually they've developed glaucoma and their nerve fiber layer is dropping. But we can't pick it up on a single OCT scan because their nerve fiber layer is still thicker than the normal database that it's being compared to. So you'd think, well, that person has a normal OCT, but because that person has already had nerve fiber layer that's dropping, might have already developed a visual field defect. And so it's very, very important to do visual fields as well. And in fact, just like with OCT testing, doing many helps you over time. Even with visual fields, doing many helps you over time, because OCT testing is generally very good for early glaucoma. But when you've got advanced glaucoma and you've lost a lot of your nerve, that's when visual field testing becomes very important. So they fulfill different purposes. All right, so some patients will ask, if you have a normal OCT but high eye pressures, will your doctor still treat you? That's an important question. Yes, in some cases the doctor may treat you. So high eye pressure is called ocular hypertension, just like high blood pressure is called hypertension. So ocular hypertension can sometimes lead to glaucoma and sometimes not. And so your doctor will look at a number of factors, like whether you have a family history of glaucoma, whether we're able to accurately measure your pressure or not, and that depends on the thickness of your cornea, whether you're particularly short-sighted or have other risk factors, in making the decision of whether to treat your high pressure or not. Sometimes they may treat it because the level of pressure is very high. So something like 28, 29, these types of pressures not only can cause glaucoma, but they can also affect the blood flow into the eye. So because the pressure is very high in the eye, the heart might have difficulty pumping blood into the eye, and that might affect the blood flow. The blood might back up and there might be a hemorrhage, and you can get what's called a vein occlusion. So there's an arbitrary level around which your eye healthcare professional may generally treat your pressure in order to avoid other conditions as well. This is even if you don't have glaucoma, if you have a normal OCT and a normal visual field. Okay, so we've covered some things. We've talked about whether the OCT is harmful to the eyes, and as I mentioned, it's not. It's quite a safe test. It uses near infrared light, and that does not damage the ocular tissues at all. We've talked about how frequently we need to do the test, and now if you look at visual field testing, for example, the modelling studies suggest to us that if you're only doing if someone is progressing very slowly, because some people can progress very fast in their glaucoma and some people can progress very slowly, if you're progressing very slowly, then if you only want it to take 2 years for you to find out if someone is progressing, then you need to do 7 examinations per year. We're not recommending that level of frequency, but you can see that often you want to know quickly about whether someone is progressing rather than taking 5 to 10 years to find out with a single test per year. So that's why some experts recommend field OCT testing every 6 months for the first 2 to 3 years that you see a patient. All right, so we've covered some of those things. I'm just going to have a look. Okay, great. So we've got some questions coming in. Okay, so the first question is, what's the youngest age a person can have an OCT? Well, there's no lower limit. Children can have glaucoma, and if they do, they also need OCT testing at baseline and at follow-up to see whether it's progressing. Generally, we would say that very young children or babies can't have the test due to technical reasons. They won't be able to perform the test. They won't be able to visualize the marker. So whatever age the patient is where they're able to sort of follow the instructions to do the test, they can have an OCT test. In terms of adults and when is a good time to have your eyes checked, if you don't have any risk factors or family history, then we recommend around the age of 40 years is a good time to start getting a glaucoma eye examination with your eye healthcare professional and a glaucoma screen, which would include an OCT test. And if you have risk factors like a family history, then we'd recommend you get that earlier, 20 to 30 years of age. But there's no lower limit. Okay, let's answer some other questions. I got diagnosed at a young age. Should my kids start getting OCT as their regular eye test? Great question. I think that the OCT will be part of their examination. So they should definitely start getting examined and doing an OCT with a visual field test and a pressure check by the eye healthcare professional is essential in establishing a baseline. Now, they might not have glaucoma at all. Not everybody with a family history of glaucoma necessarily passes it on to their relatives, but if they do, if there is, and if they do, it's great to have a baseline because, as I've mentioned before, if there's any changes as they get older, it can be compared to that baseline OCT test. Okay, I have macular degeneration. Is optic nerve scan a part of my OCT testing when testing my macula? Yes, it is. So the great thing about OCT testing is not only is it safe, it's quite quick and effective. So at the same time as you can do an OCT test for the optic nerve, you can do the OCT test for the macula. So if you have macular degeneration, you're more than likely getting frequent OCT tests of the macula. It's a different region to the optic nerve, but both tests can be done quite quickly together. Hope that answers the question. If not, please continue to write in to clarify. Does use of iPad affect my glaucoma? From Lily. Okay, Lily. No, it doesn't. So using the screen and using and a lot of near work may affect our focus, and there's some suggestions that it might affect short-sightedness in children, but there's no indication that iPad use affects glaucoma at all. So you can still continue to use your iPad, and it can be really helpful actually because it can increase font size and make things much easier to read. So go ahead and keep using it. Is it a good idea to ask my doctor for a copy of my OCT scan to keep a track of my glaucoma myself? Great. Okay, great question. So where OCT So it's a great idea to have a copy for yourself. The reason is if you move, if you change doctors, it's great to have those copies so that you can show your new eye healthcare professional. But what's really valuable often with OCT testing is that change over time. And that change over time can sometimes not be done with the paper copy printout. That change over time requires the electronic data from the scan, and the electronic data from each of the scans is fed in to the progression analysis, and then that particular machine can conduct a progression analysis. So sometimes it's very difficult, or you cannot combine tests from different machines. So if you have one brand of machine and you've had OCT tests previously on one particular brand, and then you have another brand and you've had OCT tests on the other brand, you can't really combine them together to get a progression analysis. Having the test still helps the doctor anyway, or your new doctor, or it's still good to have as a record, but you really need to try to do your tests on a single type of machine sometimes to be able to get really good progression analysis over time. So that's why sometimes, if you have scans in sort of different places, it can be a bit tricky to put them all together. Okay, great. Thanks everyone. So I hope that's been helpful. OCT testing is really important. Go out and get it done. Get your eyes checked for glaucoma. And best wishes to all of you, and have a great World Glaucoma Week. See you later.